Hi, I'm Alex, an ICU trauma nurse here to help you navigate your healthcare and the healthcare of your loved ones. In this video, we're going to talk about how to help your loved one after extubation. If you made it to this day, congratulations. This is a big day. This is a hopeful day. This means that your family member has taken the tube out and has been disconnected from the ventilator, and we're moving forward and things are progressing positively. And so congratulations. It's an exciting day. One thing I want to mention, first thing I'm going to mention is we want to make sure that we're not giving any fluids or ice. Your family member is going to come out of extubation feeling extremely thirsty, dry mouth, and they're going to have pain in their throat. We do not want to give them ice or water yet because we don't know if they can swallow. Because of the tube in their throat, these muscles are weak, and so we want to make sure that they don't aspirate, because if they do, this could mean possible reintubation, an emergency, pneumonia. So no fluids or water. I know it's going to be tough. They're going to be persistent in asking for it, but until your nurse or dietitian comes and does a bedside swallow and confirms that they can swallow, we need to stay away from that. I also want to mention that you want to encourage them not to talk. Their throat is going to be so sore. It's important to let those muscles relax. And for them to focus on their breathing. So no talking, focus on taking deep breaths and breathing. We also want to make sure that we're using the incentive spirometer. If the nurse hasn't brought it around, make sure to mention it. Sometimes they get caught up doing things, but the incentive spirometer is a machine or a little device used to encourage the patient to take deep breaths. This little device comes with a meter with numbers on them, 250, 500, it goes up to 2000. You want to ask your nurse what number you want the patient to get at. You want to make sure that they are taking deep breaths, not shallow breaths. So very deep breaths to get air to the base of the lungs and open those lungs. You want to practice it. You want to make sure that they're doing it 5 to 10 deep breaths every hour that they are awake. Okay, it's important to do that so that they don't have pneumonia, so that they don't create a pneumothorax, which can be a collapse of the lungs. It's important to take really, really deep breaths. They haven't been taking this while they were intubated, so it's important to do it now. And then we also want to create a peaceful environment for them to rest. So this is a day that we do not want visitors at the hospital. We don't want them talking on the phone with anyone. We want to focus on recovery. We want to keep stimulation to a minimum. So the main focus is the patient. I know everybody's excited. Everybody's going to want to come see this patient, talk to this patient. But we want to make sure that we just have one visitor and focus on the recovery day. This is a day that is very scary. They might be feeling anxious and scared. So making this about them and focusing on their recovery is extremely important. You want to encourage them that they have overcome a huge milestone. When they're extubated, they're going to be recovering and waking up from sedatives. They might be feeling a lot of pain. So just remind them how far they've come and that this is a good day and that, things are progressing, and encourage them to continue working hard in their recovery, because it's going to require a lot of strength, a lot of work, physically, mentally, spiritually, emotionally, to get through all of this. Once they are allowed to have fluids, make sure that they are not using a straw. This is a mistake that I see so many family members doing. When they use a straw, they are having to suck in to get the liquid. This could cause aspiration because they are sucking while trying to swallow. So straws are a big no-no. Make sure that they're just drinking water from the cup a little bit at a time. Okay, and then once you see that they're using the incentive spirometer, this is going to encourage coughing in the body. When they take those deep breaths, they're gonna wanna cough up. This is a very good sign. Encourage them to cough up the phlegm that they have going on. There's gonna be a lot of phlegm buildup when they're intubated. So the day that they're extubated, their body's gonna do what it does best, and it's going to get rid of it. If they've just had surgery or anything in the abdomen and it's causing pain to cough, make sure that you give them a pillow to hug. to help support them, but they need to cough. And sometimes it's gonna be brutal coughs. They're gonna sound really scary, and what you're gonna see coming up is gonna be really nasty. So just make sure they're coughing. Coughing is a good sign. It means their lungs are thriving, doing their thing. We wanna encourage coughing. Another thing that you can use if they're not necessarily cleared to swallow yet, but they're clear to kind of do ice and swabs. The hospital has lemon swabs and regular swabs that you can dip into ice water. Just, put it around their mouth and their lips, and make sure that when you're doing this, you always have suction ready. You should always have suction ready, even when they are cleared to drink fluids. Just in case they need that extra support and you see them coughing. If you see that they are swallowing at any point and they're coughing, that could indicate that they're not ready to receive fluids. So just, little by little, okay? Always have suction available. Also, make sure that they're warm. Being cold can cause them to hyperventilate and cannot allow them to take deep breaths. So make sure that they're comfortable, they have socks on, their blankets, put up the temperature of the room. When they're receiving oxygen, sometimes the oxygen is also cold and could cause them to be cold. The IVs that they're receiving in their veins, like the medications, can cause them to be cold. So make sure that they are warm. And I also want to remind you that they're not going to receive pain meds or sedatives at this time, because this can affect respirations. So if they are anxious, if they are in pain, just, use encouragement and remind them how strong they are, how strong their body is, and that they have come so far and that they can do this. Help them center themselves, help them focus, because pain meds and sedatives for now are out of the question. And the last thing I want to mention is make sure that they're wearing the proper oxygen. If the nurse has told them, hey, they need to wear a BiPAP, they need to wear high flow nasal cannula, make sure that they're wearing it. The BiPAP is extremely uncomfortable to mask. That goes over the face and it just pushes air into their mouth. So make sure that if they are on the BiPAP, that you are swabbing their mouth every hour, and that you're applying Vaseline to the lips, and make sure that you have suction available as well. You don't want to swab the mouth if they do have a BiPAP with the BiPAP on, because it could push the liquid into their mouth. So make sure that you take that mask off and you're doing swabbing really quick, suction, put the mask back on. You can ask the nurse to teach you how to do this. And make sure that they're wearing, their nasal cannula, their high flow nasal cannula, which can dry up their nose. If they're finding any discomfort with that, they can attach fluids to that oxygen to kind of hydrate and create an environment that is soft on the mucous membranes of the nose. If you found this video helpful, please like and subscribe. And if you have any questions, you can reach me at alexyourrn@gmail.com. Thank you, good luck, and have a great day.